started this off with an enlarged prostate back in 2015-16, and then self-managed it for a long time, too long, and I ignored it. I never took medication, only self-medicated with herbal remedies and that sort of stuff, but slowly and slowly it got worse and worse, to the point where if I needed to go to the bathroom, I had to go there and then. I couldn't wait. If I was out shopping, I'd be looking bathroom to bathroom to make sure I wasn't having a problem. If I went out for a few drinks, obviously having been a rugby player, a firefighter, we enjoy a few libations. I was backwards and forwards to the bathroom, probably 4 times for every pint I drank. And it became a standing joke. So I thought I really need to do something about this. So I went to the doctor because I had that urgency. I thought I got a UTI, and that was no. Did my PSA, it was elevated. They found I got a enlarged prostate with BPH because they did all the tests. I did the ultrasound and the CT scans to see what was going on, and I got called and said, we need to catheterise you now.
Often men with enlarged prostates may notice that their urinary flow is slowing down. They may feel that they're not emptying their bladder as much, and that can lead to having to go to the toilet more often, during the day and also during night. Patients sometimes will find that they may develop urinary tract infections. They can also get other conditions like bladder stones, and find that they need to rush to the toilet a little bit more, and find it difficult to start urination. So we use a wide range of diagnostic tests when looking at patients with urinary tract symptoms. So often it will start with questionnaires and assessment of the history of their symptoms. With regards to tests specifically, we often use blood tests, ultrasound, tests called flow rates, where we see how fast a patient can pass urine. We see what they leave behind in their bladder afterwards using ultrasound. And often we'll look at the size of the prostate with a combination of either ultrasound or MRI imaging to exclude things like prostate cancer.
I don't want to be dramatic, but being catheterised and sustaining a UTI, I thought I was dying. It's the only way to describe it. I've never felt so ill. The thought of never having a catheter removed and being permanently catheterised was something I was not prepared to live with. I didn't know how to get around that. The catheterisation kept me away from my rugby club for over 9 months because I was embarrassed. Ramsay Healthcare came on my radar through my research, really, at the end of the day. Went out and did a contract in America. While I was there, they offered me HOLIP before I went, and so I don't like the idea of that. So I started looking at what else is out there, and Aquablation came on the radar. When I came back, I spoke to the urologist. They were saying about HOLIP, and I said, well, what about this Aquablation? They said, well, actually, we've just got funding to do a trial of up to 40 men that've got enlarged prostates. We'll see if they'll take you on. And that's when I became aware of Ramsay Healthcare.
Aquablation therapy is a relatively new technology which has been available in the UK for a few years now, and we've been carrying out at Ramsay for just over 2 years. Aquablation uses water jets to remove prostate tissue. Now it starts off with real-time image guidance, so we can actually see exactly where the prostate is, and that allows us to offer a personalised treatment plan using water jets and avoidance of heat energy to optimise outcomes for patients. When we look at the outcomes for aquablation therapy, looking at the trials that were carried out a few years ago now, we can see that there are a number of improvements. First of all, patients can expect to see an improvement of their flow, a reduction in their symptom scores, but also one of the most important things to realise is that the potential side effects associated with other treatments aren't necessarily the case with aquablation. So the risk of erectile dysfunction or incontinence is less than 1%, and the risk of ejaculatory dysfunction is less than 5%. And we also know that these results are durable, so when we look at 5 to 7 year data, we can see that the reoperation rates after aquablation are much lower than other technologies. The procedure itself is done under a general anaesthetic and takes about 45 minutes to do based upon the patient's prostate size.
My whole experience with Ramsay Healthcare, even coming in for the pre-op tests and everything else, was fantastic. When I arrived, I was shown the utmost courtesy, taken to a beautiful room. We had Wi-Fi so I could keep working for the day while I was waiting for my procedure. And then the food was good, the bed was warm, the TV wasn't too bad, so I can't ask for any more than that. I think as a man, Christopher Blick understands the potential mental effects of being catheterised, having a prostate trouble, and all those emotional and mental health issues. And he had the ability to explain it to me in a way that I could understand and I could take it on board.
One of the most common reasons for patients looking into aquablation therapy is the preservation of sexual function and continence when compared to traditional techniques. So we reassure patients that that's something that we also hope to achieve. Other questions patients often ask is when can they go back to work? I normally say that it depends on what they do for a living. Mobility-wise, patients are back to normal mobility almost immediately after surgery, but we do recommend avoiding anything strenuous, heavy lifting, exercise and things for a few weeks just to allow them to recover fully.
I'd say the recovery was really quick. As I say, I passed blood for 2 weeks, to the day, and then I went back pretty well to everything as soon as my body would let me. I actively still play rugby, I actively get in the gym, I actively get out and do physical work, and so yeah, I didn't notice that I was not able to do anything, whereas with a catheter I could do nothing. Aquablation has been a godsend for me. It's given me my life back, because I think what it does is it allows a man's mental health to be maintained as well as his physical health. I would recommend Ramsay Healthcare 100%. I cannot thank them enough for the treatment they gave me, the respect that they gave me, and the follow-up contact. People have spoken to you after to find out how your experience was. So yeah, 100%. It's given me back. That's the only way to describe it. It's given me back.